running out of time because there are a few delays here and there. And also we'd like to welcome our speakers for today all the way from Singapore, Sister Ivy. Sister Ivy is from White Angel Caregivers Consultancy. She's actually a qualified nurse, and I get to know her when she was working in Singapore. She's actually doing nursing privately, and she goes home to teach family members, maids, how to take care of bedridden people. That's a little bit I got to know about her, but she will maybe explain more what's the background. And we also with us today, she got a friend, Mr. Lam Hayet, who's also behind. He also will be helping Ivy to answer some questions because he's from the registrar of orthopedic surgery. And from what I know here, he has been joining a lot of conferences, including International Pediatric Orthopedic Symposium in Florida, USA. And also he has spent a big time in Indonesia, seeing patients and assisting them in knee scopes and also total knee replacement. So he wants a little more information on how to taking care of the lower part of the body. These are the two people that are most important or most knowledgeable. Okay? So without further ado, let us invite and I would like to hand over.
Before we start, practical work. We need somebody to do orthopedic.
Please take the VIP seat over here.
The front VIP seat, yes.
Yeah, okay, that's great. I usually have very loud voice, though I'm small. But anyway, thank you very much for being here. I'm really glad to be here. I arrived in Malacca this afternoon, and I'm so glad to have Jay, Chu, Jay's mother, and Hazel to bring us around. We have very sumptuous Nyonya food. And in just a short period of time, we actually tour around Malacca. And it's really a beautiful place, a lot of food to eat.
Yeah, I know, but they never call me.
We're going to invite you, but we're short of time today. So today our topic is on fall precaution. Okay. So before I start, I'm going to just give you a short video, just for laugh video, and then we will proceed. Okay. Just enjoy the video.
Sure.
After the best medicine. Why English?
Yeah, the thing is, for them also, okay.
Now just a little introduction on the both of us. I'm a course facilitator and a trainer. So basically what I do is I train aides or caregivers how to take care of elderly. Okay? More so of elderly who are bedridden. My working experience is in medical surgical field, in the wards as well as emergency department, and currently will be home care. Dr. Lam himself, he is a surgeon, so his working experience also has got the accident and emergency department. That's where we met. And follow on, he has many years of experience in surgery, adult and children as well. So I'll leave it to him to explain to introduce to you more. Okay. Right. So at the end of this workshop, I hope that we will be able to identify the various causes for fall, to reduce your risk of fall, and as well as to state the 6 different tips that I have for you to prevent fall. If you look in the statistics, 1 in 4 over 65 years old will have a fall. So if we look in our context, if we have 4 elderlies together, there is a very high chance that 1 in the 4 of us will have a fall. It can be a small minor trip or a major one. Okay, of course we try to avoid most of them as possible. And 70% of them will develop psychological effects of fearing to walk again. Now this is based on our papers in Singapore on Straits Times. This is a survey that they done. Now what do I mean as 70% will develop psychological effects? Like most of them after the fall, if they manage to stand up and continue walking, that's very good. But then again, they will always have this psychological trauma. Yeah, they will be afraid of falling again. So that's what I meant as a 70%. So what are the causes of fall? We look into 2 major aspects. One is on personal reasons, and the other is on environmental. Of course, both personal and environmental we can avoid or we cannot avoid. Okay? So we'll look more into it. For personal reasons, first, cognitive. Cognitive, we talk about 3 major aspects. Concentration. Sometimes we are very tired and we lose concentration. So just when you are thinking about something or feeling a bit sleepy, you trip over something. Okay? Memory. Sometimes as we enter into a certain age group and then we cannot deny that everybody goes through aging. Even myself. From a baby to an adult, from a teenager to an adult, we go through the process of aging. So there's nothing to be, it's nothing frightening about aging. It's just that how we want to encourage active aging, right? So in the memory part, as we grow older, sometimes we may be more like, we lose a bit of memory and then we may do something that we want to do. So orientation as well, sometimes, especially patients with Parkinson's, Alzheimer's, some dementia, they affect as well. And vision. Do we all agree that as we grow a little bit older, our vision gets impaired? Yes. Even myself, I'm starting to need spectacles as well. So it is a very normal thing. So as we cannot see so well, things start to become blur or double vision, then can also affect us.
Yeah, I see hazel.
Nutrition and diet. Now it's very important for all of us to have a very healthy diet and to keep ourselves strong. So what happens is, if you do not have a good diet, you are not strong enough, sometimes your legs give way. Medical conditions. I don't need to ask you what conditions you have, but if you know yourself, some of us has got some maybe high blood pressure or just simple, even high blood pressure is very common. If you see 1 in 2, maybe they have high blood pressure. It's a very common thing. So these are the things that can affect your health condition, can affect will cause you to have fall. Okay? And last of all, I look into physiological changes. Okay, as we go a little bit weaker, as our legs are no longer so strong, these are physiological changes. Physiological changes are basically changes that happens over time. It happens. You try to avoid, but you can't do very much because it's over time. Environmental. I'm not sure about any one of you here has got this hoarding problem, but we see a lot in America. There's even a channel, a TV channel series on hoarding, right? So I remember my mom is like that, my grandparents are like that. So if you're not like that, very good. If you are, you just have to be more cautious. Maybe keep a path for yourself, and then you can just chuck the chunks away at one side. Because you don't want to trip and fall. So environmental could be someone, this is a very common thing, you know, banana skin, right? And cots. This is something that I want to highlight. Sometimes we just lay the cots on the floor. We didn't realize that it could be a harm to us. Okay? Wet floor, of course, we try to avoid. What are the different effects of fall? Who can tell me what is this?
The knee.
The knee?
Oh, wrist, it's a wrist.
Very good. Very good. So smart. How do you think a person can sustain a fracture like this?
Golf.
When
Yes. Yes. That's right. Very good. You are so smart, all of you. So yes, what happened is when we fall, our natural reflex is to stretch out our hand to break the fall, right? But what happens is, when I said earlier on physiological changes, sometimes women tend to have osteoporosis. So you get brittle bones, you get your bones are not so strong anymore, and sometimes when you outstretch your wrist, you fracture it. Okay, see like this man. This is another common one. That is, who wants to give a guess? Hip. Very good. Excellent. So that's hip. So the hip joint gets a fracture. Can you see? And about this is that sometimes the fall gets very, very severe. Okay, we may injure our spinal cord, fracture any of the spinal bones, and resulting in being bedridden. This is a stitch. So it's common to see this in the emergency department also. Sometimes they fall, they cut their head, and therefore they need staplers. This is staplers. Normal, we just use stitches. So yeah, these are the tips to how do we prevent falls. Now we're going to go into these important things. I break it up into 6 tips. Number 1, prepare yourself before you step out of the house. How do we prepare ourselves?
Be mindful
Mindful?
Yeah.
Mindful of what?
of your steps.
Okay, our shoes. Yeah. At home we are pretty safe. You see, now we're not wearing any shoes. We have complete contact on the floor. So we can feel and be very careful. But sometimes if we are wearing slippers, or when the sole is no longer so rubbery anymore, we tend to step on something and slip. I always advise my patients to wear shoes, cover shoes. Okay? Cover shoes is not easy to slip off also. Okay? It protects yourself pretty well. Good eyesight. So how do you get good eyesight?
Wear glasses.
Wear glasses and keep constantly, sorry? Yeah, that's right. Check up. Sometimes your eyesight fail not because of your degree has worsened, but maybe we have cataracts, right? Maybe we have other conditions like glaucoma and things like that. So get it checked.
Sister, can you,
Sorry?
the previous picture, my proposal you should change this Japanese slipper because many people actually fall on this Japanese slipper.
Yes, that's right.
The strip there can just flip off and then
Correct. Yeah. So this picture is to tell you that if you were to choose, do not choose to wear slippers. In fact,
but the bottom
it's
there,
on
put
the-
a
Safe footwear.
Oh.
so
You
it's
should
not
put
right.
a cross
I
there
see.
for that
You
word.
should
Safe
put the
footwear
cross,
actually means
put the
this.
tape.
I see. Okay. So this picture is to let you differentiate that
Okay,
which
okay.
one
That
you
is
not
not a
wear.
Japanese slipper, you know.
Huh?
That is a very expensive slipper, you know. For 190.
Yeah. So I'll emphasize the point that this tool is to show you that if you have the slippers and the shoe, to choose the shoe. This is safe footwear. This is not. lot, especially for senior citizens who live on their own. They have chairs around, and sometimes they are not steady. They either hold the wall, which is quite steady, but once they hold the chair may move. So when it moves, it will fall together with the chair. So it is advisable to know when do you need a walking aid. Okay, most of us do not like to use a walking aid because it may not look so stylish. So you want to look good and you want to have a beautiful aid. You can have this suggestion of Chu has brought a very beautiful umbrella here. Now this umbrella is multi-purpose. So not only it can shield you from the sun and rain, it also has this handle. This handle is very good. In fact, the normal walking stick has got this kind of handle. If you look at over here, right? Yeah. So of course, if you look at these two, they are pretty similar. Okay, this is what is very light. This is very light. So what is good about these two and similar is that they both have a white base and a rubber white base. This is what you need. If you like to use a normal umbrella, just buy an additional stopper to help you. Okay, this walking stick is used when you are quite strong. You just need this as an additional support. Okay, when those time when you thank you very much. So if you think that with this you're feeling a bit unstable, okay, don't be shy. Just go on to the mat and see if you can get this quad stick. This quad stick is like a eagle claw. Okay, it has better stability. However, you have to also be taught how to use this. If not, you may also trip onto your own quad stick as well. This one is very good. It's a bit bulky, but if you're tired, you can open it up and sit. So these are for people who are often they feel tired, so they can have this. You know, in Singapore, our MRT are usually very, very crowded. You will hardly be able to find a seat. To get this is very good. So, and finally is the walking frame. Walking frame is for people who has more of like a medical condition when their legs are really, really weak. If using one, they are unable to walk. So they use 4. It's like a full frame that can really, really help you and stabilize yourself. Okay? Third, let's be neat. Okay, this place when I come in is very neat. Your things are nicely stacked up and it's very safe for everyone, even for kids or children. So we try to keep neat and not have any cords and wires in the floor. So we try to work on dry surfaces and clean up spills. Clean up spills, of course, I talk about at home. In a home context, if you spill some water, quickly clean it up. Okay? If you wait, you may set and sleep. The 5th tip is allow circulation adjustment before standing up. Do you have this feeling of giddiness when you first get out of bed in the morning? Sometimes? Okay. Anyone else? Not so much, huh? Okay. So what happens when you're lying down on the bed? Our blood circulation is missing. It flows in the brain and throughout the whole body. But the moment we sit up, the brain, the blood from the brain drain down to the other limbs, and then we start to feel a bit giddy. So the advice is sit down, wait for a while, and then once you feel better, the circulation runs, then you can stand up. If you are feeling of having this giddiness very often, you should consider consulting a doctor. So, what are the 5 tips that we have shared earlier on? Do you remember?
So you go back to the slide.
That's one option. You choose option 2. Okay, that's right, environment. Anyone else?
Getting a mental staff, not to block the way.
That's right. because I've seen elderly fall and then they have fracture at the back of the skull and they end up having a raccoon eyes like a panda. This patch is called bruised up. So you don't want that to happen, you have to remember my 5 tips. They are prepare. So prepare yourself, wear a good footwear. Use an aid if you need to. Third, be neat. Fourth, keep dry. And fifth, adjustment. So adjustment means waiting for circulation and then adjust your life using the aid. Okay? You have panda, alright? So thank you very much for your time. I would like to pass this time over to Dr. Lams on hip fractures.
Welcome.
Hi, my name is Kayet. I'm actually a registrar at the KK Women's and Children's Hospital in Singapore. I'm not a professional speaker like Ivy, so it's very common for people to fall asleep when the doctor stops. Yeah. And okay, so today I'm going to talk a bit about hip fractures, which is a very common condition that we see when elderly patients have a bad fall. So I've worked in quite a few hospitals, even in Singapore. We visit every 1 year or after year on rotate in hospitals as part of my training. So no matter which hospital I go to every night, when one or two patients come in for exactly the same problem, hip fractures after a fall. Some of them are very poor thing. Some of them they have a fall at home 2 days ago, and nobody knows about it until the friend or the son decides to visit them, and they realize, oh, they're actually on the floor, covered with feces, because they cannot make their way to the phone, cannot make their way to the door. It's so painful after hip fracture. So I just going to give a very short talk about it. So the incidence is the highest in patients more than 65 years of age. 15 to 20% of patients in fact die within 1 year of this fracture. In the past, before we started having all these treatments for hip fractures, the moment you have a hip fracture, usually it means that your days are numbered, okay, for many reasons. Okay, usually happens in female more than males, and this is mainly because the osteoporosis is more common in females as well. So it is fracture related to osteoporosis, which basically means your bones are weak. Okay. So 3 to 5% of falls in older adults result in fractures. Okay. And hip fractures are one of the most common types of fractures. These are people who have done their studies and here's their conclusions. And with the hip fractures after falls, other common fractures they can have include spine, the vertebrae, forearm fractures, leg fractures, ankle fractures, pelvis fractures, across upper arm and fractures. Okay? And hip fracture rates increase with age. And 85-year-old patients are 10 to 5 times more likely to get these fractures than people aged between 60 to 65. And in fact, more than a third of patients who have hip fractures are unable to walk again. Okay. So this is a picture of a patient who has suffered a fracture on the left side. So basically what happens is the leg is shorter than the other side. It is externally rotated and turned outwards, and it is very painful. If you look at the skin, sometimes we have a lot of bruising on the side of the hip. Okay, so when you have either hopefully it's not yourself, but your family members, someone you know who has had a fall and they're just lying in bed, refusing to move, they see the leg is a little bit out of position, then you have to suspect it's a hip fracture, and I think you'll be wise to bring him over to the hospital. So, can someone tell me which side of the hip is injured, fractured? Left side, very good. Yeah, you all very sharp. One you can see. Okay, so this is a pelvis X-ray. So it basically shows us both sides. Very important, when you do an X-ray, you need to have both sides to compare. Sometimes the fractures are very, very tiny. You can't see, very, very small line, not very visible. Okay, but in this case, it's very clear the fracture is going through the neck of the femur. Okay? Yeah. Other types of fractures that are around the hip are the intertrochanteric fractures. Okay? The trochanters are the ridges at the side here. Okay? The greater and the lesser trochanter. So a fracture that goes through is called an intertrochanteric fracture. And that one is a subtrochanteric fracture, because the fracture goes below these two lines. And what is the treatment of patients who have hip fractures? So like I told you in the past, before we came out with all these treatment methods, when we have hip fracture, the mortality rate is very high. Of course, other than surgery, the first thing that we can think of is traction, leg traction. Okay, so there are people that come out in many ways to think of what's the best way to immobilize the leg so that it's not so painful when the patient is lying in bed. Okay, on your left, that is the straight leg traction. On your right is the Hamilton Russell traction. So both of them actually, no matter how you get it, it's very uncomfortable. Okay, so you're stuck to your bed, you can't move. And for fractures to heal, it usually takes 6 weeks or more. So can you imagine lying in bed with some traction like this for more than 6 weeks? Okay, so a lot of problems that can happen when you lie down in bed for so long. You're absolutely right, bed sores. Second, infections can happen. Why? Because you can't breathe properly. You're lying in bed all the time. Okay, your lungs cannot expand, your chest infections. It's very difficult to get up and go to the toilet, so you have to use a pot, at the bedside. What happens is you don't clear your urine properly, you get urine infections. Then on top of that, what else you can get deep vein thrombosis. Deep vein thrombosis is the condition that you get when you sit aeroplane, economy class syndrome. The blood gets clotted in the legs because you don't move around. And of course, things like bed sores will come in. So, generally speaking, if patients are fit enough for surgery, what we advise them is to choose to go for surgery, in fact, because it means that they can get out on their feet much faster. Even if they're unable to walk again after operation, most important is they can sit up very quickly. Okay, so they can at least use the toilet, they're not fixed to their bed for more than 6 weeks. And you can take away all the problems of a recumbency lying down bed. So these are the next few slides will basically show us the different ways of fixing different types of fractures. So it doesn't mean that your doctor offers you one operation, it looks different from the slides which I showed you, or someone which another friend had, another operation someone had, doesn't mean that it's wrong, because there are many different ways to fix different fractures, and depending on the fracture, depending on your condition, they will choose different types of treatment methods. So this is one of the most basic types, a cancellous screw. So each of these screws are about 7.3 mm size, and you put 3 of it through the teeth. These are usually for the undisplaced fractures, the very simple type of fractures. Okay, so your bones are still quite intact, still quite strong. The screw just help you keep it in place. Another common fixation is the dynamic hip screw. The dynamic screw basically has a barrel and a screw. This screw can slide in the barrel. Okay, so as patients, once they start walking, okay, there's a compression force at where the fracture site is. Coming out in the last 10 to 20 years is this intramedullary nail. Okay, so instead of the plate sitting at the outside the bone, now we put the nail inside the bone. Even better. Why? Because it shares the load. Okay, it shares the load when you walk, when you step. Certain types of fractures, this is more useful. Okay, and it looks scary. Yes. So, good question. All these implants, they're usually either stainless steel or titanium. So, most of the companies have made these implants to be left inside the body for life. Okay, so up to about 20-30 years inside the body, nobody has shown that there's any side effects of having it in the body. Beyond 50 years, nobody really knows yet. Okay, so most of the implants that we put in, we will leave it inside. Because to surgery, no, there is no age limit to surgery. Okay, we've operated on 100-year-old patients before, and it really depends on what conditions they have. Some 100-year-old patients, in fact, if you live to 100 years old, I would say you're actually quite fit. What I see is that the 100-year-old patients are actually very, very healthy. They don't have much medical problems, and they're usually quite angular. You can walk at least walk at home on their own. So this is another type of fixation that has come up recently, very similar to the dynamic hip screw, but these are called locking plates. There's different technologies for different things. And this is another very common thing that's called hemianoplasty or hip replacement. Okay, sometimes the fracture is so bad, or it happens very, very proximal. That means the fracture is very, very near the neck, where the blood vessels to the head, where the head is. Okay, this kind of fractures, no matter how we fix it, you know that the head is going to slowly die off because the blood supply has been disturbed. Okay, so in this kind of circumstances, the surgeon will tell you, no, we can't fix it. We need to replace it. This is better. Alright, so sometimes we choose to do this, and what happens is we will take out the part of the bone that's fractured already, put it metal implant. These metal implants usually last for 10-20 years, depending on activity level. So if you are very active and you, even after operation, you continue being very active, in about 20 years, usually you need a revision surgery. Most importantly, after operation is rehabilitation. Okay, so it doesn't mean that after operation immediately you can walk back to normal. That means a very, very slow process. Okay, I would tell my patients usually between 3 to 6 months to expect. Okay, so you must remember, just like I said earlier, 1/3 of patients never walk again. Okay, and this 1/3 also includes patients who have had operations, you know. Okay, so why? Because doesn't mean that after operation you definitely can walk. Some patients they are very sick to begin with, they are quite weak to begin with. After an operation, you know, takes up another amount of their energy, their strength. By the time the wounds heal, they want to walk, they realize they're so weak, it's very hard to rehabilitate them back to walking. Okay? So the other 2/3 of patients, luckily for them, they're able to walk still. And I think that's an achievement in itself. Okay? Because hip fractures are very big fractures and very difficult to deal with. Okay? The underlying, I mean, after all these slides and all that, I'm not trying to teach you all how to treat hip fractures. All you need to do is there's many different ways to treat hip fractures. But the most important take-home message is prevent. Okay, because that's what you all can do. You all are healthy now. You all are, you know, ambulant. You can walk in the community. You come down here to listen talks. So it's very good. Yeah. So how you can prevent the falls? So adapt the PANDA rules that ID has taught you all. How to prevent the falls. And the other thing is how you can prevent and treat osteoporosis. Okay. Beyond 30 years of age, every one of us starts aging. Your bones start aging beyond 30 years. Yeah, you hit this thing called peak bone mass at 30 years old. So your bones are strongest at 30 years. From then on, every year you just get weaker and weaker and weaker. And this is normal. Okay? So osteoporosis is a big problem. Even in a lot of developed countries, Singapore and America, everybody is having this problem. Okay? And one of the ways that you can prevent it is through regular exercise. What I tell my patients is you need regular exercise. What do I mean by regular exercise? Basically, it's walking for more than 30 minutes, 3 times a week at least. Okay, that's the bare minimum of what at least the Singapore Ministry of Health recommends as regular exercise. Okay. A balanced diet, don't. I'm not sure that any of you are vegetarian. Is it a
Mix.
Yeah, so mix. Yeah. So I mean, coming from our teaching, a balanced diet is very important. Okay, so don't nitpick, don't say I don't eat this, I don't eat that. Have a wide variety of diet, and that should ensure that